my name is Amy Sturkey. I am a pediatric physical therapist, and I'm really excited. Today, I have with me Whitney Choi, who is a young adult with Athetoid Cerebral Palsy. She has full body involvement. She's going to college. And I wanted to do an informational series on what is athetosis. And what is going to be really cool about this is we're going to present this information together, and we're going to together try to educate about athetosis and Athetoid Cerebral Palsy. And to have someone who has Athetoid Cerebral Palsy as being a co-presenter on this is just really exciting. Hey Whitney, why don't you introduce yourself?
Hello, I'm Whitney, and I'm so excited to making this informational video.
So you may have noticed that our backgrounds were different because we are not in the same place. We're not in the same state. In fact, she's on the East Coast. No, I'm on the East Coast, she's on the West Coast. So what you're going to see in this interview as we talk about Athetoid Cerebral Palsy is us talk back and forth and be in different clothing and different backgrounds, and because it's filmed over several different days. I hope you won't find that too distracting. Okay, so we're talking about Athetoid Cerebral Palsy, but I really feel like we ought to start off with cerebral palsy first. What is it? Cerebral palsy is a condition that's caused by atypical development of the brain or damage that was done to the movement, the areas of the brain that affect movement at the time of birth, before birth, or after birth. It is, in terms of the damage that was done to the brain, it is non-progressive, meaning that part of the brain, it doesn't get worse over time. The effect of the involvement may get worse over time, but not the part of the brain, that part of the brain damage is not included in cerebral palsy. So cerebral palsy can look different according to the person, according to where the movement area of the brain was damaged, and then how much damage was done to the brain. There are 4 basic types of cerebral palsy, so let's go through those.
Spastic cerebral palsy makes up 80% of people with those with CP. You will find people with this type muscle stiffness on one side of a joint. It tends to be present in patterns of flexion or extension. Also, it tends to be worse the further you go, so that feet, for example, are more stiff than hips.
The second type of cerebral palsy is the dyskinetic type. So these are people, if they have dyskinetic cerebral palsy, they have difficulty controlling movement. They can have slow and writhing kind of movements or fast and jerky kind of movements. Their whole body can be involved, as well as their face and their tongue. And because of that facial involvement, specifically their tongue and their mouth, they have difficulty eating, drinking, swallowing, sucking on a bottle or a nipple, and talking. So these people make up 12 to 14% of the people have cerebral palsy.
Ataxic cerebral palsy makes up 4 to 13% of those with cerebral palsy. They have difficulty with coordination, balance, and an unsteadiness while walking. They also have difficulty with fast movements and movements that takes a lot of control.
The 4th type of cerebral palsy is a mixed type. So you can have a mixture of different types of cerebral palsy all together in one body. And the most common mixture is spasticity with the dyskinetic type. Whitney, I'm curious, of these 4 types of cerebral palsy, what type of cerebral palsy do you feel like you have?
I definitely think I have athetoid and spastic. Although I have uncontrollable movements, there are certain parts on my body that have tightness.
Athetoid cerebral palsy tends to be caused by a short-term but very significant loss of oxygen, affecting a full-term baby in the late pregnancy or early birth period. The loss of oxygen causes damage to the basal ganglia and the thalamus. Another common cause is neonatal hyperbilirubinemia, which causes kernicterus. Kernicterus is not as common now that advances have been made in neonatal care. Because the damage has happened later in a baby's development, individuals with athetoid cerebral palsy can have higher cognitive function, but notably, they can also have severe intellectual challenges.
So cerebral palsy is the most common type of childhood disability. Those cases of cerebral palsy occur in 1.5 to 2.5 births in 1,000 births. Now, athetoid cerebral palsy, it's much less common. Cases of athetoid cerebral palsy happen in 1.8 to 3.5 cases per 10,000 births. Now, there are several conditions that go along with athetosis. Commonly along with athetosis is intellectual disabilities, speech difficulties, and seizures. Other problems that may go along with athetosis are weight loss, difficulty feeding, respiratory issues, and sleep problems. And musculatory problems include difficulty with joint contractures and muscle tightness. Whitney, do you have problems with any of those co-occurring conditions?
I have severe speech impediment, feeding issues, weight loss, and sleep issues. In early development, they have delayed motor development and less movement. They tend to present as low tone at rest and varying tones when moving. They keep longer primitive reflexes. They may be born with normal birth weight, but are often underweight at follow-up due to feeding and swallowing difficulties.
By 2 to 3 years of age, the involuntary movements that's like a classic hallmark of athetoid cerebral palsy start to happen. What you see with them on their back is they tend to be very extended. On their stomach, they learn very quickly that those arms are not to be trusted. Those arms are inconsistent in their ability to keep extension. So these individuals learn quickly that they are not a good thing to hold up their head, because when they give out, their face busts on the floor. So these children often learn to hold themselves up with a much more trusted back muscles than their arm muscles. And so what you often see with them on their stomach is people with athetosis will be arched up and not weight-bearing at all on their arm. Unfortunately, the lack of weight-bearing on their arms has really a snowballing or cascading effect on their development. What you see is that without the weight bearing on the arms, they don't develop a lot of arm strength, and without that arm strength, that they aren't propping on their elbows and reaching, and they are not pushing up on straight arms, and without pushing up on straight arms, they're having trouble learning how to crawl, and without learning how to crawl, the next step is being able to pull up to stand. That is really difficult. If they pull up to stand, they tend to do it leaning on their trunk as opposed to pulling up and holding on with their arms. If you do not learn how to use your arms well, you don't learn to cruise along furniture, and all that lack of practice and pulling up and cruising along furniture means learning to walk can be really tricky for this population. You often see in this 2 to 3 age range that them have their head turned to the side or difficulty even after they learn higher skills with head control. Now, without the upper extremity weight bearing, other things are affected too. For example, when you fall, the first thing that happens when you fall is, well, you try to catch your balance without actually falling, but after that, you put out your arms and your hands to catch yourself, and without all that work and weight bearing through your arms and arm control, it tends to be that people who have athetoid cerebral palsy are poor at catching themselves when they fall. So it is not uncommon for people with athetoid cerebral palsy to have damage to their front teeth from falls in which they did not catch themselves. Parents should really consider, if their child is more upright and moving, getting a helmet that helps protect their face and their teeth. One of the things you also see is that their vision can be affected. So not only might the muscles of the eyes be affected, but the head control is also poor, and without that head control, good head control, you don't have a good base for your eye control. Similarly, all that practice of reaching and moving through space that you would get in normal development does not happen as easily with people who have athetoid cerebral palsy, so it in turn snowballs into difficulty with vision. People say that their fluctuating tone is worse with extreme emotions, happiness, fearfulness, anger. It's also worse with stress or with sickness. Whitney, how is that true for you?
Well, it's worse when I'm excited about something or nervous. I'm not sure about other emotions because I don't really notice it unless I record myself. I don't know if that's normal. The most common treatments for athetosis are occupational, physical, and speech therapy. They may additionally seek nutritional counseling to address poor weight gain and being underweight. They are often burn up calories easily and are inefficient in their movements, which means they are burning more calories than an average person. They can also have difficulty eating and swallowing, affecting weight gain.
The difficulties with the oral motor control that you see in the babies, where they have difficulty with the sucking at the bottle or the nipple, and the difficulty with swallowing and later with chewing and moving food around in their mouth, all that practice that is not happening in normal development, that affects their ability to speak. Also, the muscles of the neck and the tongue and the mouth, they are not uncommonly hijacked for postural uses. And if you're using your mouth and your tongue and your neck to help hold yourself up, that it really makes it more difficult, in my experience, for the people who have athetoid cerebral palsy, who have higher skills, to also be able to talk. This, in turn, has a cascading effect because humans are social creatures and we, by nature, want to communicate, and people who have difficulty communicating can often have emotional health difficulties. Depression is not uncommon, and they may need counseling for behavioral issues. Whitney, do you see any corollaries with these things in your life?
Yes, I have always had problems making friends all of my life. Like, I grew up being around other people with CP, but I was never in their friend zone. I know that I have other disabilities that affects my ability to communicate. But I still think my CP plays a role of it. It is encouraged that powered mobility to be used early. Options for powered mobility should be considered with any child who is not pulling to standing or crawling by 12 months, or who is not walking independently by age 2. If the child's speech is significantly delayed, a communication device is recommended. Early monitoring by an orthopedist is recommended to watch for hip, back, leg, and ankle problems. Supported standing and walking are strongly recommended for children not pulling to standing or crawling by 12 months. I think that toddlers now are using mini power chairs. I want one of those now. Do they have one for adults? I got my first communication device in the 1st grade, but didn't like it because it only had like 40 messages, so it did affect how I communicate grammar-wise.
In terms of treatment, medication-wise, there really are not great effective treatments to specifically address athetoid cerebral palsy. One of the most common treatments for athetoid cerebral palsy is baclofen. It can be given by mouth. Baclofen is a medication that does not go across the blood-brain barrier well, so you have to take higher doses if you take it by mouth. If you take it intrathecally, which means you'd have a pump that's inserted usually in your stomach area, and then a tube takes the baclofen directly into the spine. That intrathecal way of getting baclofen tends to be more effective with people who have athetoid cerebral palsy. Whitney, I'm just curious, for you, what medications have you tried?
I take a low dose of baclofen, and it does help with the spasticity that I do have. I am interested in having a baclofen pump and see what it can do to me.
The lifespan of people with athetosis depends on how severe the case is. Individuals with more severe involvement will likely have a shorter span than those less significantly involved. Death is commonly caused by respiratory problems, often caused by pneumonia or aspiration. This certainly makes a case for staying on top of feeding safety and encouraging those individuals throughout their lifespan to be as active as possible aerobically to promote improved lung functioning. Involvement in community recreation programs and regular walking programs are crucial.
Because of individuals with athetoid cerebral palsy have such significant movement difficulties and communication difficulties, it is not uncommon for these people to be more likely than other people with cerebral palsy to need to have caregivers throughout their lives. And this need to be dependent on others affects your self-confidence and your mental health. This is seen even more so with people who have athetoid cerebral palsy. I want to say that every person that I have met personally with Athetoid Cerebral Palsy have some things in common, but have a really lot of things different. Every person you're going to meet with Athetoid Cerebral Palsy is going to be their own unique person. And so in this video, we've talked about some of the commonalities, but in order to know more about Athetoid Cerebral Palsy, you really need to meet the individuals. I hope you will listen to some of the other videos that I have done with people with Athetoid Cerebral Palsy, such as Whitney, and I hope this is helpful, and we'll look forward to seeing you next time. Whitney, thank you so much for helping us with this video.
It was really fun making this educational content, and I really hope people this helpful. Bye!
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.